When cancer spreads, finding where it started can be a challenging mystery even for pathologists and experts. We can have a tumor sample from brain, lymph nodes, liver, or bones, but it can actually be a lung cancer where the cancer originates from. So this place that the cancer starts is called primary site of origin in metastatic cancers. And as part of clinical practice, we generate routine pathology slides, which are basically a small tissue, a small tumor sample for pathologists to identify the cancer subtype or look for certain pattern. But what pathologists can't reliably do with these slides is to identify the primary site of origin. And for that, they usually request further testing like molecular or genomics. So here our question was that, can we use the power of AI here to identify the primary site of origin using these tissue slides or not? And whether AI can identify the metastatic status just using these slides. So the way that the AI model can answer this is like a Google search. Think of it like a Google search. The AI model goes, and when new patient comes into the clinic, goes to the hospital archive and finds all the similar patient in our hospital's cohort to those of the new patient. Here, the red and blue groups of patients are our matching groups of patients. By having these matching groups of patients, we can actually learn from what happened to them to make decisions for these new groups of patients, especially for rare cancers. This can be in terms of their outcome, their treatment, and their shared biology for doctors to make a more personalized treatment based on the similarity with the previous patient. So we put this idea into test on a rare metastatic cohort from BC Cancer's POG program, which is part of Marathon of Hope. And we had more than 1,800 rare cases covering more than 14 organs and also more than 225 different cancer subtypes. So on the primary site prediction task, which is a super challenging task even for the doctor, the model could achieve 40% accuracy. This is still 6 times better than random. And also the model could differentiate between primary versus metastatic cancer with an accuracy of 80%. So given this challenging nature of this task, this is a really good performance for this model, given that we didn't use any human annotation or label for training this model. So the model is completely unsupervised and can be served as a tool for pathologists and doctors in the hospital to narrow down the search space and the possibilities for each new patient in the clinic.